LGBTQ plus individuals, active duty service members and veterans, multiracial individuals, American Indian, and Alaskan Native women. And unfortunately, only a fraction of these survivors actually seek medical care. When you receive care after a sexual assault, the care should center on you. There are four pillars that should happen when you receive care after a sexual assault. The provider should ensure your safety, both your physical and emotional safety. You should be able to trust that provider. They should set honest, clear, and consistent expectations with you. You have a choice on what happens next for your care and during the exam, and nothing should be done during the exam without your okay or approval. And also support. That healthcare provider should be supportive. They should be a team member with you, and they should work alongside you and not on you. And then I also wanted to point out that you don't actually have to seek legal aid, or you don't have to seek a police report before you have an exam, or talk to anybody with the law before an exam. There's another important thing. You should get care quickly as possible. You want to try to avoid showering, changing clothes, eating, or brushing your teeth after a sexual assault. But if you do, care is also still available to you. It just can decrease the amount of evidence that can be collected during the exam. Evidence should typically be collected up to 3 days or 72 hours after an assault. But however, it can be collected up to a week after an assault. Another thing is that a provider should treat your injuries and talk with you throughout your medical history. They should also explain every part of the exam before it happens. There's specialized providers for sexual assault. We sometimes call them a SANE provider, which stands for Sexual Assault Nurse Examiner, or a SAFE provider, which stands for Sexual Assault Forensic Examiner. And these providers are specially trained to provide comprehensive medical care for people who have experienced sexual assault. So they actually understand the nuances of a sexual assault. And so it's important that when you see one of these providers, that there's certain expectations that should be that you should have with them. You'll also be checked on emotionally, and that's during the exam, and also follow up after the exam, because your mental health is just as important as your physical health. Now I have a true and false statement, and if those could, if you could participate by just saying true or false. First one, you must report to the police to receive medical care. Any takers on that one? Okay, we got a false, one false there. Another false. All right, and the answer is false. Like most of you put in the chat, you don't have to report to the police to receive medical care. Next one, if you shower, change clothes, or use the restroom, it's too late to collect evidence. True or false? Yeah, so far I got false there, and that's false as well. So you don't have to shower. I mean, you shouldn't shower, because again, it will decrease the amount of evidence that's collected. But if you have, it's still not too late to collect evidence. And you need health insurance to get an exam after a sexual assault. True or false on that one? And let's see a few falses. And that's false. You do not need health insurance to get an exam. There are entities and organizations where you can get an exam after a sexual assault that is free of charge. Next, I'm going to be talking about testing and protection from infection. Your provider can test for and help prevent sexually transmitted infections. The various things that we test for include chlamydia, gonorrhea, trichomoniasis, HIV, syphilis, and hepatitis B. If nothing is found right away, follow up testing can be done again at 1 to 2 weeks, and testing again at 4 to 6 weeks and 3 to 6 months. This is especially done with HIV because sometimes HIV cannot be detected in the early stages, so you would need follow-up testing. Empiric treatment, which means presumptive treatment, meaning that we're going to presume that you have the infection, is what we treat. And the rationale for this is because sometimes follow-up can be hard for survivors, and sometimes or oftentimes we don't know the status of the assailant or the perpetrator. And so regimen includes ceftriaxone, which is an injection, a one-time injection that's given for gonorrhea, doxycycline, which is an oral antibiotic given for chlamydia and is taken twice a day for 7 days. And for trichomoniasis, we give metronidazole 500 milligrams twice a day for 7 days. And again, this medication is usually recommended to start right when we see you on the first exam. And so we don't necessarily have to wait for results for this. Vaccinations are recommended. Hepatitis B is a vaccine recommended to protect from a hepatitis B infection, which is a liver infection. If a person knows what their status is, meaning they previously have been vaccinated for hepatitis B, then they won't necessarily need to get the vaccine. But if their status is unknown, whether they received the vaccine or not, then we would recommend to give the vaccine. HPV vaccine, which stands for human papillomavirus, is a vaccine that protects against cervical cancer and genital warts. It's recommended in anyone who's been unvaccinated between the ages of 9 to 26. And then there's also tetanus vaccine, which is recommended if there's been any bodily injuries or skin wounds. We would recommend getting a tetanus vaccine as well. We also recommend HIV prevention medicine. If there's a chance of HIV exposure, the provider is going to recommend a month-long course of medication. This medication is also known as PEP, which stands for post-exposure prophylaxis. Most effective is when it's started as soon as possible, generally within 3 days. A full month of daily medication is recommended, which equates to 28 days, and you'll be giving your first dose right away and generally enough to take home. The next thing is that finishing the full course matters because we want to obtain the most efficacy. So it's important to finish the entire course. And sometimes providers can also do reminders throughout the course of treatment by doing follow-up calls and sometimes even doing a follow-up visit where you would actually come back to the doctor within 2 weeks. And sometimes there's even transportation available for those who don't have transportation to do follow-up visits. There's also support for that too, just to keep a person on track with taking their medication. I'm just touching a little bit on preventing pregnancy. Emergency contraception should never be withheld or delayed, and you do not need a pregnancy test first. Various things are given to prevent pregnancy. One is called a copper IUD, which is an intrauterine device that's placed within the uterus. It lowers the pregnancy risk to 0.1% and can work up to 5 days after. It can stay in as ongoing birth control. Another one is ulipristal acetate. It's a prescription pill that works up to 120 hours or 5 days after. And also available over the counter is levonorgestrel. It generally works best within 72 hours, but it can be less effective the longer you wait. And then just to kind of note that the efficacy of oral pills can decrease with higher body weights. So an IUD or intrauterine device may be a better fit. True or false question. You have to wait for STI results before receiving treatment. So, all right, so that is false. Like stated before, you do not need to get results because we are going to presume that you may have an infection. And in many cases, we don't know the status of the assailant. So we're going to go ahead and start treatment. Another true or false. There is a medication that can help prevent HIV if taken within 72 hours of an assault. So that one is true. And that medication is Truvada plus Tivicay. I didn't like speak specifically on the medication, but those are common medications, Truvada plus Tivicay. And then there's another one called Icentris. But ideally, they should be started again within 72 hours. So healing takes time, and that's okay because, after a sexual assault, there are many things that can occur both mentally and physically. I just want to touch on them briefly. One is PTSD, also known as post-traumatic stress disorder. And another things that can also happen is depression, anxiety, and individuals can also feel suicidal. Substance use disorders can also occur. And so it's important that when we see someone who's a sexual assault survivor, that we also get them the right support that they need through mental health support and mental health counseling. So that's something that should be also done after a sexual assault. Your physical well-being is also affected. Some individuals experience chronic pelvic pain, dyspareunia, which is painful pain with sexual intercourse, functional somatic disorders. That's where individuals can experience pain and just different complaints of pain in different body parts. Chronic widespread pain, like I mentioned. Some individuals experience fibromyalgia, which can be usually like a body-wide pain, associated sometimes with numbness and tingling. And it's also associated with depression. Functional GI disorders or gastrointestinal disorders. Some sexual assault survivors will experience a lot of chronic abdominal pain, nausea, vomiting for days and months afterward the assault. Chronic fatigue, and sometimes sexual assault survivors will experience chronic urinary tract infections. We are here to support you. If you or someone you know has experienced sexual assault or intimate partner violence, confidential help is available 24 hours a day. Trained advocates can provide crisis intervention, medical and legal information, safety planning, and referrals to local resources. Support is available, again, whether or not you choose to report to law enforcement. And these are just a couple of resources I wanted to give you. The first one is the RAIN National Hotline. It's the Rape, Abuse, and Incest National Network. And there's a 1-800 number, and you can also text directly to them. And they offer support 24 hours, 7 days a week. The National Domestic Violence Hotline. They give support for relationship and domestic violence situations. They have a number you can call directly or text directly. And local care options are also available through federally qualified health centers, also known as FQHCs, and title clinics. A few of them in DeKalb County. Some of you may have heard of them. One is MedCura, another one is Mercy Care, and Grady also is considered a federally qualified health center. Title 10 clinics are going to be your health departments, DeKalb Board of Health, things like that. And veterans and for active duty service members, the VA offers lifetime care for military sexual trauma at any VA facility. True or false? If you don't feel upset right away, it means that the assault really didn't affect you. So that's false. So again, sometimes things can manifest after the assault. Sometimes it can take a couple of weeks, sometimes a couple of months, and you can still have after effects, in both mental and physical, after sexual assault. So it's important to note that. Help is available also through the Georgia Network to End Sexual Assault, and this is their website and their direct phone number. And then another true or false: free confidential help is available 24 hours per day, 7 days a week. And the answer to that is true, through the RAIN network. Just some key takeaways. After a sexual assault, you're not alone. There's individuals that can help you, like I mentioned, through certain organizations and entities. They have specially trained individuals, the SAFE provider and the SANE provider, again, stands for sexual assault nurse examiner and sexual assault forensic examiner. Care does not require a police report. And there's certain pillars that the care should center on, like I mentioned: safety, trust, comfort, choices. You have a voice in this, and there's things that you don't want to happen. You don't necessarily have to feel forced into doing certain things. The healthcare provider is your advocate. And time sensitive options work best, meaning you need to get medications as soon as possible to decrease the chances of developing infections. And exams are free by law, and follow-up is also important, especially if you take certain antibiotics. You want to get follow-up sometimes within 2 weeks and sometimes within a month. And then free confidential support is available 24 hours, 7 days a week. And that is the end of my slideshow.
Thank you so much, Dr. Simmons, really for helping us understand the immediate medical care, all of the care that is provided for us, and the resources that are available to our survivors during this time. We're now going to pivot to our family nurse practitioner, Molly Neal. And I really want to kind of build on that conversation. So, through your years of providing sexual and reproductive health care services at Planned Parenthood, I'm sure you've cared for many patients with many different backgrounds. And survivors can often leave the hospital with questions such as about pregnancy prevention, reproductive health care, and what are really the options that they may not have or may have available to them. So, in regards to in light of the changing laws and unequal access to care that we may see right now, can you help us understand the current reproductive healthcare landscape, any barriers survivors may encounter, and what are the available resources to help them make informed decisions?
Yes, thank you, Najuma, and thanks, Dr. Simmons. That was great. So let me see if I can share my slides here. Okay, can everyone see it? Okay. All right, so this is piggybacking off of Dr. Simmons' talk, and some of my information is similar, but it also goes into more options for what you can do after a sexual assault, and really giving you information to make those decisions for yourself for what's best for your body and for your life and your situation. So just some notes before we start. This presentation discusses sexual assault and its impacts, as you all know. Some material may be difficult or triggering. Please take care of yourself and step out if needed. In order to be inclusive of our gender diverse community, this presentation will use gender neutral language wherever possible, acknowledging that not all people who can become pregnant are women. That said, I quote some statistics that the study was done and the results are framed in men and women, so then I'll say it that way. This is a safe space to ask questions without judgment. And this presentation focuses on medical aspects of survivorship and does not constitute legal advice. Uh-oh. I lost my slides. Okay, they're there. Okay. So again, some review from Dr. Simmons. You are not alone. According to the CDC, in the US, nearly half of women and over 1 in 6 men in the US report experiencing sexual violence in their lifetimes. Nearly half of transgender adults report experiencing sexual assault at some point in their lives. And approximately 1 in 4 women in the US have an abortion in their lifetime. Reclaiming autonomy after sexual assault is a huge thing. I feel like sexual assault is a huge theft of your autonomy, and it's a violation of your autonomy. And so what you can do afterwards to get it back is to be able to be armed with the information you need to make decisions for yourself about your own body and your life. Reproductive autonomy is the power of individuals to make independent, informed decisions about their own reproductive health, including contraception, pregnancy, and childbearing, free from force, discrimination, or coercion. The medical provider that you see is the expert on medical care, but you are the expert on your body. If something doesn't feel right in your body, speak up. You can ask for a second opinion if wanted. Try to choose providers who are trained in trauma-informed care, and I'll go over some lists of resources at the end. And you can absolutely bring a friend or a professional advocate to your visit. Some of the organizations at the end of the talk also provide medical accompaniment for these exams. I just wanted to touch on a framework called reproductive justice. It's a framework combining reproductive rights and social justice, and it was coined in 1994 by a group of Black women now known as Sister Song. It focuses on the right to maintain personal bodily autonomy, the right to have children, the right not to have children, and the right to parent children in safe and sustainable communities. Reproductive justice looks at how race, class, gender identity, and immigration status affect health choices. This talk and my medical practice in general are rooted in reproductive justice. And again, it's the framework for being able to provide any patient with the information that they need to make the right decisions for their lives. So now moving into the medical information to support your autonomy and reclaiming that autonomy. If someone's pregnant when a sexual assault happens, the infection prevention recommendations are the same as in non-pregnant people, so the same as what Dr. Simmons went over, although the medications may differ slightly for what's safe in pregnancy. Pregnant people can take PEP to prevent HIV. Again, the medications might differ slightly from people who aren't pregnant. And if someone gets assaulted while pregnant, medical evaluation is recommended to make sure that there was no harm to the fetus, cervix, or placenta. If someone's not pregnant and they want to prevent pregnancy from an assault, they can take emergency contraception. So generally, emergency contraception stops pregnancy before it occurs. It does not cause an abortion. The sooner it's taken, the more effective it is at preventing pregnancy. And emergency contraception is legal in all 50 states. There are 2 types of pills. One is levonorgestrel, commonly known as Plan B. There are other brand names as well. It can be bought over the counter at the pharmacy. You don't need a prescription, and it works best within 3 days of unprotected sex. The other pill is called ulipristal. Brand name is commonly called Ella. That one is prescription only, and it works best within 5 days of unprotected sex. And then there are the IUDs. Actually, both the copper and hormonal IUDs can be used as emergency contraception if placed within 5 days of unprotected sex. They're more effective than the pills at preventing pregnancy, but they're also more invasive to place. And they can be left in place for ongoing birth control if desired. And then some survivors might be in an ongoing domestic violence situation or an ongoing situation that is unsafe. So they might want to consider, if they want birth control, options that are not able to be detected or not able to be tampered with by a partner or someone who's abusing them in an ongoing way. So those options would be Depo-Provera, which is also known as the shot. That one someone can get once every 3 months, but it does change most people's periods. So if someone's periods are being monitored, then that might not be the best option for them. There are also the IUDs. They're placed in the uterus. You can request that the strings can be cut very short so they're not felt by anyone. The IUDs last for 5 to 12 years, depending on the type, and they're immediately reversible once they're removed. The copper IUD doesn't change how often your periods come, doesn't change the pattern, but they might be slightly heavier than your baseline. And then the hormone IUDs usually cause light or irregular or absent periods. And then there's the implant. It goes under the skin in the upper arm. It can be felt if someone knows where to feel for it. It lasts up to 5 years, and it's also immediately reversible once removed. That one often causes unpredictable menstrual changes. And then if a pregnancy happens. So for any pregnancy, there are 3 options. A person could continue the pregnancy to parenting. They could continue the pregnancy and then put the baby up for adoption, or they could have an abortion. I'm going to go into some details on abortion, not focusing on any specific outcome as what's right or better, but just knowing that these are the options available to anyone, and talking a little bit about abortion specifically in Georgia. So right now, the legal landscape is in flux. It's currently being fought in court. So things may change as cases go through. Georgia currently bans abortion if a quote unquote heartbeat is detectable by ultrasound. What that really means is cardiac activity. The heart as an organ is not actually formed until later on in the pregnancy, but cardiac activity, which is like contractile cells, are visible on ultrasound starting around 6 weeks gestation, which is actually only 2 weeks after a missed period. So many people don't know they're pregnant yet at that point. Some additional barriers to care for an ultrasound, or additional barriers to abortion care in Georgia right now, is that an ultrasound is required to look for that cardiac activity. And then there's a 24-hour waiting period. Also, if a minor seeks abortion in Georgia now, they must have consent of a parent/guardian or a judge. Georgia law does allow abortion between 6 to 20 weeks gestation if the pregnancy was the result of sexual assault or incest. However, this requires filing a police report, which may be extremely traumatic and possibly a safety risk to the survivor. And many Georgia abortion providers are unclear on this law, and they're afraid of performing abortions past 6 weeks due to the risk of imprisonment and losing their medical license. So from the research that I did, I couldn't find any cases that successfully did this. So many pregnant people in Georgia either travel out of state for an abortion if they want one, or they do seek telehealth medication abortion shipped from other states, which is called self-managed abortion. This is legally complex because it is not legal in Georgia, but it can be legal in the states where medications are coming from. So the state laws are in direct conflict with each other. Medication abortion symptoms, possible complications, and follow-up care are medically identical to miscarriage. So if a person seeks medical care after a self-managed abortion, they have the option to disclose if they took the medications or not. And choosing not to disclose their self-managed abortion would not result in a worse medical outcome. Now I'm going to move into some resources for different population groups. Like Dr. Simmons said, all survivors in Georgia can receive free sexual assault forensic medical exams, which are billed to the state. And those can be done regardless of the person's documentation status, and they do not require reporting to law enforcement. Here are some local survivor assistance and advocacy groups. The links should be active hyperlinks, so when we send out the slides, people can access the websites. There's Mosaic Georgia. They have free and confidential 24/7 crisis intervention, advocacy, medical accompaniment, and legal assistance. There's the Grady Survivor Advocacy and Forensic Evaluation Center, which provides trauma-informed crisis support, advocacy, and counseling. And then a national organization that Dr. Simmons also touched on, RAIN, which has a free 24/7 hotline. And then also for people who might be underinsured or in Georgia and have a hard time accessing abortion if they want one. There's Access Reproductive Care Southeast, which offers financial assistance for an abortion procedure itself, as well as practical logistical help such as rides, lodging, and childcare for someone while they're getting their procedure. There's the Bridget Alliance. It offers major logistical coordination and financial support for travel, food, lodging, and childcare, typically for people navigating care further from home. And there's the National Abortion Federation Hotline, which provides financial assistance and case management for clinic-based care across various states. If anyone has a question about a miscarriage or an abortion, they can call the Miscarriage and Abortion Hotline, which is staffed by a team of experienced doctors and nurses to answer any questions people might have. There's also reproductive legal helplines, which provides free legal help, representation, and financial aid to people facing criminal or civil action related to their pregnancy outcome and abortion care. And some resources for immigrants, refugees, and non-English speakers. Many of the services and hotlines on the prior slides provide trauma-informed services in languages other than English. And the services do not ask about documentation status, nor do they report to the immigration authorities. There's Tapestry, which is a multilingual crisis counseling and legal advocacy for immigrant and refugee survivors across Georgia. And then an organization called GAIN, Georgia Asylum and Immigration Network, which provides free immigration legal services for survivors of sexual assault, intimate partner violence, or human trafficking, including some help with visas. And some resources for LGBTQ+ survivors. There's the LGBT National Help Center, which offers free confidential peer support and local resource referrals via the national hotline. And FORGE, which is a national organization focused on healing and advocacy specifically for transgender and non-binary survivors of sexual trauma. Okay, some frequently asked questions. Is emergency contraception the same as abortion? No. Emergency contraception prevents pregnancy by delaying ovulation or blocking implantation of the egg. It does not work if someone is already pregnant. How is it legal to get abortion pills from other states? Some states, like California or New York, have laws that protect their providers who send abortion medication across state lines. This can be in direct conflict with the law in the state of the recipient. Test cases are currently making their way through the legal system. Will a medical provider know if I took abortion pills? Generally, not unless you tell them. There's no lab test to tell if someone has taken abortion medication. Rarely, a person may choose to take abortion pills vaginally rather than in their mouth. It's less common, but in that case, pill fragments or chalky residue may be visible in the vagina for up to a couple days after use if someone is having a vaginal exam. Does abortion make it harder to get pregnant in the future? No, abortion does not affect future fertility. About 50% of people ovulate within the first 3 weeks after an abortion. If I get a forensic exam, do I have to report the sexual assault to the police? I know Dr. Simmons already went over this many times, but no, you can decide if you want to report the assault. The exception is that if the survivor is a minor, the healthcare provider is required by law to report it. Okay, and then I'm open to Q&A.
Let's see. Yes, we have a question here. How can survivors find trustworthy information and understand what options are available to them, especially if they're uninsured or have limited resources?
Yes, so I would reference a lot of these organizations. A lot of these organizations, these survivor assistance and advocacy groups, they're providing free and confidential services. The sexual assault forensic exams are covered by the state for everyone. And then for reproductive health services, again, like Dr. Simmons went over, a lot of the like Title 10 local family planning or federally qualified health centers have free birth control options, and then the abortion funds can help with people access the abortion care if they would want it. All of these helplines, the miscarriage and abortion hotline, the Repro legal helpline, also are free.
It seems like we might have a quiet crowd, or maybe. Oh no, we have another question. How does a father approach this issue in support of his daughter?
That's very sweet. I mean, so he could, if the daughter is open to it, the father could help schedule appointments for her, could help attend appointments if they're open to it, help with any of the logistical care that the survivor might want. And then, being a family member and being that supportive kind of loving cocoon for a survivor after an assault is so special and so important. That I think that would be wonderful if they would be involved, if that's what the survivor wants.
Well, thank you guys so much for sharing your expertise. It looks like we're about maybe at 6:50. I do not see any other questions coming in at this time. And if we do receive any after we close out, we will definitely, this is just to the audience, we will gather those questions. We will ask our providers so it is accurate information that we're disseminating to those that are registered. This recording will also be posted as well. So we ask you guys to share all of this great and empowering information that we've received throughout the night. And so again, I just really want to say thank you again to Dr. Simmons and Molly for sharing your compassion and your commitment to ensuring survivors have access to accurate information and quality care. On behalf of World of Akivaland, we also want to thank each and every person for joining us this evening, and your thoughtful participation. You just being here says a lot. And if we haven't answered any questions, please feel free to keep asking. We're open up until 7 right now with the chat. And if you'd like to learn more about World of Akivaland and our work in supporting youth and families, please feel free to connect with us. We are at World of Akivaland, that is ALKEBULAN.org. .org. And we would love to be able to continue this conversation or get you connected to those experts in the community. So at this time, it is my pleasure to hand it back over to Miss Jennifer Clark for our closing remarks. Jennifer, the floor is yours.
Well, I just first want to say wow and thank you. I know I learned so much this evening. And, I heard, and it was so comforting, and I hope it was comforting for any of you who are listening to hear over and over and over from each voice that you are not alone, that you are not alone. And I want to invite my colleagues who have joined this meeting today to please feel free to add International Women's House to your list of providers, for clients, for advocates who are available to support individuals who are navigating such experiences. We also partner very closely. We're out of DeKalb County, and we partner very closely with agencies like Tapestry, like GAIN, like Mercy Care. We're all very close-knit community-based partners. So if you connect with one, you connect with us all. As I close this evening, I really also want to sincerely thank each of you for not only joining us and being part of this conversation, but we want to thank our funders as well, the Criminal Justice Coordinating Council, whose commitment to prevention, education, and survivor-centered services makes conversations like these possible. At International Women's House, our commitment to your well-being, your healing, and your dignity, it extends far beyond tonight's session. If you or if someone you know feels unsafe in the very place where you should experience love, protection, and peace, please know this. If you heard nothing else tonight, know that you are not alone, that we believe you, that we believe that you deserve to be safe, that help is closer than you may think. Our 24-hour crisis line is also available whenever you're ready. You can reach us at 770-413-5557. That's 770-413-5557. And you can also connect with us on Facebook and LinkedIn by searching International Women's House, or on Instagram at IWH Atlanta. We're here 24 hours a day, 7 days a week. We will answer your call. And until then, we hope that you leave today feeling a little bit more informed, a little more empowered, and reminded that healing is possible, that your voice matters, and that your body belongs to you. Thank you again for joining us, and have an amazing evening.
Thank you.